Hey everybody, it's Dr. Ozzie with the Functional Medicine and Wellness Center. We're going to go over Cyrex testing, food allergy testing today, and some of the differences between what you might see with your family practitioner or allergist and what we do. First off, when we look at food allergies, they could be a big problem with people's health today. 60% of your immune system is in your digestive tract. So pretty much any condition you can think of, digestion and the foods that you eat may be part of the problem or actually causing the problem. So pretty much everybody out there who has any kind of pain or discomfort or syndrome or symptom or even disease would probably benefit from this type of testing. So the differences are, if you go to your typical allergist, they're going to look probably for what they call IgE, which is anaphylactic type of food reaction. And most people have seen this or heard of this, where someone eats a peanut and it's a life-threatening condition, they swell up like a balloon, they can't breathe, they need to go to the nearest ER and get help, immediate help. The testing we're talking about looks for something that's called delayed food allergies. Some people talk about food intolerances or food sensitivities. We're looking for delayed food allergies, which is basically food allergy that you usually don't notice because it happens about reaction 24 to 36 hours post eating the food. So, and some people, they actually start to become addicted to the food and actually feel good when they eat it. And at this point, it can be really confusing. So Cyrex is basically the #1 in the country. They look for the most different parts of any particular food that you might be having a problem with. For instance, most companies only look for one part of the gliadin molecule that, or protein, and there's probably about 100 points in that gliadin protein that there could be a food sensitivity or food allergy in this case too. So they're most in depth because there are a lot of false negatives. So we use Cyrex. There's the third array that they do, and it just looks for wheat and gluten, and it looks for about 20 different parts of the gliadin protein, and that's best case scenario to make sure that you either have it or don't have it. And then there's fourth array number of the Cyrex testing, looks for cross-reactivity and food sensitivities, or pardon me, cross-reactivity and molecular mimicry. And all that means is big words for your body might actually start to perceive other foods as a threat just the same as wheat and gluten. So you got a wheat and gluten issue, and then your body's perceiving these other things to be the same, and you still have the same reaction. So everybody who believes that they have a wheat and gluten problem, especially a celiac, would want to do this testing for cross-reactivity, because this could actually be some of the substitutes that they're using, and those substitutes could actually start becoming a problem, or always been a problem for them, and they actually don't feel the benefits of a gluten-free diet. So those are the people that would want to take a look at that. And the next one would be Cyrex #5, which actually gets into autoimmune conditions. So a lot of these food sensitivities or food allergies can eventually upregulate your immune system, and if you're genetically susceptible, could be one of the reasons why, or the complete starting point for your autoimmunity. So they look for about 24 different tissues, but they look for antibodies. And these antibodies they've found are just part of your immune system, and basically they're the kind of guys that go out there and say, hey, we're not going to attack yet, but if we're told to, we're going to start attacking this particular tissue. And these antibodies can show up about 6 to 8 years prior to a condition in developing. So it doesn't mean you're autoimmune, just means that your body's kind of building that ground or that soil for autoimmunity. And obviously that's pretty darn preventative. If you see those antibodies already happening, now you can start looking to see, is there autoimmunity? And if not, at least I can start doing some things to try and dampen that down so that I have the best opportunity not to become autoimmune. So Cyrex, delayed food allergies, and then anaphylactic food allergies are two totally different things. One's acute, one's more chronic. And if you have any more questions about that, you feel free to look at our website. It's the functionalmedicinecenter.com. Once again, www.functionalmedicinecenter.com. and or call our office at 214-395-7264. 214-395-7264, and we look forward to seeing if we can help you. Have a great day.